how does that look? So thank you everyone for attending this event today, and to Mira, Nikki and the Centre for Engagement and Dissemination for initiating this very necessary conversation. The fact that we had over 300 registrations shows the interest in and importance of this topic. And it's my pleasure and privilege to lead this conversation. And I'd just like to start with some general housekeeping. So feel free to keep your camera off and keep your mic off too, especially if there's background noise. If you experience any technical difficulties, please send a message to Nikki Bent, and her email address is on the screen. And if you could use the chat function and question answer boxes for any questions. And the session, as Mirat said, the session is going to be recorded to allow people that can't attend to watch the presentation. The recording will be deleted after 60 days. And if you don't want to be recorded, please feel free to keep your cameras off. And as Mira said, you can change your profile name on your Zoom. So I'm going to be joined by Cherelle and Nick, and I will leave them to introduce themselves, who will share some reflections on impact and evaluation from their perspective. We will have the opportunity for questions at the end of the presentations. Please put these in the chat. And after that, we're going to attempt to put people into self-facilitated breakout rooms for discussion. And we've also created a Jamboard and a Mentimeter for people to leave comments. And please feel free to email with any thoughts. I will put my email address in the chat and alongside the Jamboard. And what I'm going to attempt to do after the event is to write a blog or similar capturing the themes that we have raised today. And we very much want this to be a conversation, but accept that this can be challenging when we have so many people online. And I think Nikki has a couple of poll questions. I don't know if they'll come up on the screen or in the chat. Okay, so when we were organising this event, the all-important question was raised: what will we call it? And we wanted to use the word reflections in the title in the hope that this would become a reflective space for discussions, but also to highlight that each of us is coming at this topic from an individual perspective. So I'm going to share some evidence from a rapid systematic review that I was involved in, and also some other research, but essentially this is my take on impact and evaluation. And I'm open to the fact that my biases, both acknowledged and subliminal, have affected what I've chosen to say. But we felt it was important to discuss who is and should be involved in evaluating the impact of public involvement. Why do we evaluate the impact, including should we, and what are the impacts that we should be evaluating? The how is a conversation for another day. And we also recognise that this event is only going to scratch the surface of this topic and is part of the ongoing programme of the necessary conversations. So I live with a rare autoimmune rheumatic disease and multiple long-term conditions, and although I'm an experienced public contributor and have recently become involved in co-production research as a peer researcher, my positionality and perspective will always be informed of my experience of living with conditions and navigating care. Oops, right, I can't get my slides to move on. Oh, well, there we are. Sorry about that. So I remember when I first came across the concept of evaluation and impact at this conference in 2018. And I was only at the start of my PPI journey then, and still at the stage where actually I was just grateful to be involved. And in the open discussion session on the last day, a member of the audience stood up and stated, people don't become involved to have their impact evaluated. And that made a big impression on me. And I started reflecting on questions such as who is pushing the involvement, impact and evaluation agenda, academia or the people involved? Will it end up being another thing done to people, not with them? What metrics should we use and who are they important to? Is this another area where we concentrate on what's measurable rather than asking, is it meaningful and to whom? And is it fair to evaluate the impact and involvement when the people involved often have no power over the terms of their involvement? Do you value the impact I could have made or the impact I was allowed to make? Can we ever assign a value to relationships, and what do we value? The so-called soft skills and time needed to build relationships, or the hard currency of things such as grant income, methodology, and publishing in high impact journals? In involvement, what makes an impact? And does this depend on the context of the involvement or research topic? And crucially, does current research culture create the necessary conditions for involvement to make an impact? So with all these questions buzzing around my head, I thought it was important to look at what the NIHR says in impact. And there is much here that makes sense. Why wouldn't we want to look at the contribution that research and involvement makes to security, makes to society, the economy, and the benefits to individuals, organisations, and nations? What's not to like? But the assertion that impact is the term for the outcome and not the process itself troubles me a little. And I like this definition much better. It's much more inclusive. The changes, benefits, and learning gained from the insights and experiences of patients, carers, and the public when working in partnership. And when thinking about what to say in this presentation, I remembered this wonderful paper from Christina Staley and Duncan Barron. And these findings resonate with me as the authors state, with this framing, there is no method for involvement, but a wide range of approaches that need to be tailored to the context and the needs of the individual involved. And they pointed out that PPI in research has evolved in a culture dominated by evidence-based medicine. And do we conceptualize involvement as an intervention? And I love this alternative approach that is involvement as conversations which lead to two-way learning, and it's the quality of interaction that's important. So impact was on my mind when I became involved in the Value of Co-Production research project, and I helped to co-produce the Rapid Systematic Review. And I developed what the experienced reviewers in the team told me is known as reviewer rage when coding the papers, because many of them only mentioned co-production in passing and didn't provide any evidence of the process. And we found what has been termed conceptual stretching, billing things as co-production when they weren't, which can also be described by the term faux production. Also, there was much ubiquity, putting co in front of everything, co-development, co-design, co-reporting, without defining what actually happened. And these were the reasons why the Co-Production Collective wanted to do the Value of Co-Production project, because they were often asked, why should we co-produce research as service policy? What is the evidence base and what is the impact of co-production? And we wanted to produce evidence answers, but crucially in a co-produced, values-led way. And an early finding was the richest co-production descriptions and evidence were in papers that were co-authored. And to me, this evidence is the fact that involving people has impact and benefit. And very few of the papers described co-production happening through all the parts of the research cycle, which was disappointing. At best, there were what has been termed pockets of co-production, which begs the question, how do we co-produce and involve people? Who makes the decisions about the extent to which people become involved and in what part of the research cycle? Who holds the power here? And how does this affect the impact that can be made by involvement? So I think here is some evidence of why you allow people to become involved in matters. As getting it wrong most of the time points out, the primary outcome in a trial is the most important piece of data collected. And the researchers asked clinicians treating and people living with kidney disease and breast cancer whether they agreed with the primary outcome selected, and over 70% didn't. And I asked the question via Twitter, how many of the trials that you cited in the research had involved patient and public involvement in outcome selection? So we looked at the papers and the answer was none. And the justification for one of the principal investigators of the trials was interesting. They said, in generating the protocol, we did not specifically ask for patient input. I felt that all of my patients taking the older drug would agree with this goal and the protocol. And even when public contributors are involved, how much power do we have? And these papers, two of which have used ethnography, which is the researcher actively participating in and creating a an account of group interactions are interesting as they take a deep dive into how involvement is actually enacted. So Sarah Knowles found that researchers seek a monophonic or single patient voice to legitimise their decisions and found ways to discredit people for their disagreement, in this case making a judgment on their representativeness. And this fits with what I often say, that public contributors are like Goldilocks porridge and have to be just right without any say in what right is. And Annette Boas found that a persistent pattern emerged of planned co-production activities slipping back into more conventional and arguably extractive research relationships, such as asking the public contributors to complete surveys. And in this research, the importance of academic publications trumped co-production at every turn. And in Stan Papoulis's ethnographic study, one of the participants said, "The question is whether you see the PPI role as a kind of limpet on a ship. The shipper's research and the PPI representative comes and plonks itself on it and has very little contact with what the researchers are doing. You are just stuck on the side of something and people are very polite and they ask your opinion, but basically they're doing what they want." And Stan found that PPI is essentially out of sync from the deliverables seen as important by prevailing academic cultures. So I will pop the links to these papers in the chat, and I think they're really worth a look if you haven't read them. So do we really know how decisions are made about the influence and impact that involvement can have on research? So as myself and Jordan Canning asked in a blog for the Co-Production Collective, which we wrote after a few difficult experiences, are we showing our working when it comes to patient and public involvement in co-pro, the joys and challenges? Do funders check to see if the involvement that was promised is actually happening? And do public contributors have the power to write and publish about their experiences? How transparent are we about involvement and what happens? So if I return to the value of co-production research, these were our top level findings, which I think backs up Christina and Duncan's position and pushes back against the more common definition of research impact. Simply put, in co-production, and I would argue involvement in general, the journey is as important as the destination. And interestingly, what we found in our review was that where the journey was mentioned and described, it was mostly in relation to the people with lived experience, not the researchers. So I would say that we are all in a journey when we co-produce, but how often is that recognised? And importantly, we also found that for co-production to flourish, we all need to push back against academic identity and cultures, which mirrors many of the findings from the research I previously mentioned. And I'm not presenting this as a them and us, and I know that these issues frustrate researchers and PPI leads too. And I, like many of you in the audience, have been involved in some great projects where PPI made an impact. And I'm not attempting to decry the great involvement that is going on. I just feel that there is still work to be done because research is hope and we become involved for a reason. And if we didn't think our involvement could make a difference, we wouldn't waste researchers' time. And I like the finding here that co-production is a complex methodology. It needs to be resourced, planned, evaluated and reported, just like any other research methodology. But crucially, the values underpinning co-production can be seen as a mechanism through which change is achieved. And this thing that we need to shift the current thinking from a product output to also emphasize the impacts of the process of co-producing together. And also this need to challenge academic culture, hierarchy, and status quo, which can be challenging. So I have crossed over to the dark side and am prepared to consider evaluating impact in involvement in co-production. I'm very clear about the impact that involvement and especially co-production has had on me, in particular co-producing the Value Research Project, and also the qualitative research that I've been involved in, which has been looking at people's experiences of shielding, which we co-produced. And I've developed research skills and expertise that have been utilised in other projects I'm involved with. And how do we start to capture what I like to term the longitudinal impact for projects and for people. But as always in involvement, I see this through the lens of power differentials and prevailing academic cultures and hierarchies, and would suggest that it's time to co-produce the ways of evaluating impact. Public contributors need to be involved from the outset. If you aren't at the table, then you're probably on the menu. Culture eats strategy and frameworks and tick boxes for breakfast. And, you know, I really like this recommendation, which states that evaluation methods need to be co-produced. And this will require us to develop creative and flexible ways to consider impact, which can sometimes be hard to articulate or anticipate. An evaluation plan should ideally look at project impacts and contributor impacts to assess the total impact of the project. And we need to do work on practical ways to measure the enactment of values and principles. And I leave you with what I feel is the fundamental question here. Is the current culture in research such that involvement is allowed or can make an impact? Thank you. Right, so I'm going to stop sharing now and pass over to Mira and Cherelle, who will talk about impact and evaluation from another perspective. Thanks, Mira.
Thank you. Thanks. So Cherelle, hello. So I'm going to interview Cherelle for the next session, just so to have a bit of difference in terms of how we present. And the reason for this little section was just to kind of put what Lynn had already spoken about into a different perspective, and look at the impact that this all has on people living with conditions, how they access health and care research, and how that develops, but also how it can impact treatments as well. And so we're going to talk to Cherelle now. So, and Cherelle, and little baby who's joined us as well. I won't mention his name on the on a recorded thing, but so yeah, hi Cherelle.
Hi, how you doing? Thank you for having me.
Thank you for joining us. So Cherelle, tell me about yourself.
So my name's Cherelle Augustine. I'm actually 37 in 7 days actually, and I've have sickle cell disease, which is a long-term condition that you're born with genetically. So growing up with sickle cell, I've always been very educated about my own condition through my hospital, which was London North West Hospital Trust, but more specifically to me, Central Middlesex Hospital. And I was taught about my condition from a scientific point of view. And even though I was quite a shy person, I was very articulate about my condition. So I've been involved in educating doctors and nurses from a very young age, and firefighters and paramedics, where they would have sessions, training sessions, and then they'll bring us in, or myself and usually one of my friends in at the age of 10, 8, 12. And we would literally go in there and talk about our lived experiences of having sickle cell. And we always got such great feedback about the impact of actually understanding how it affects you as an individual, because they obviously know the science and the background about it, but to know how you experience their services, how you're treated, and the impact of your day-to-day life is really impactful. And it just was one of these situations where I was always doing a talk somewhere, and then there was a crew of us that kind of grew up together from babies, because our parents were part of the Brent Sickle Cell Support Group for sickle cell and thalassemia. And unfortunately, one of my friends passed away at just before the age of 18, or just after the age of 18. And we came together. It was my mother's idea, but there was 4 teenagers. So 2 of us were 17, just turning 18. Well, 3 of us were that age, and 1 of us was 16 at the time. And we came up with the idea of Broken Silence, which is a charitable organization raising awareness for sickle cell. But instead of how we always saw sickle cell was kind of promoted or awareness shared to adults. We wanted to share awareness to young people, not just young people with sickle cell, but young people in schools, because a big issue of sickle cell is the stigma. I remember growing up, some people wouldn't turn up to certain under 18s raves that were made for awareness of sickle cell because they thought they would catch it. And it's not a condition that can be caught. You're born with it, just like your eye color, your hair color, your skin color, all of that is hereditary and you can't catch that. So it was kind of come together in memory of Leona Dehaney and to educate young people about sickle cell, and then the whole plan is they would then go home and talk about it and talk to their families about it, and the education would spread through that word of mouth, through educating, through using the arts. So we had annual talent contests. So the talent was anyone was able to join, and it was the entertainment factor, but then there was always something within our talent contest that was spreading awareness about sickle cell, and it's usually done creatively. So the first year we learned that having a talk was very boring and it was too clinical. So we started doing like plays that kind of just showcase certain scenarios of what it's like to live with sickle cell at different phases of your life. And that really was something that people loved and spoke about and raved about. And even to this day, even though we've stopped doing them, they keep saying, oh, when are you going to do Broken Silence Talent Contest again? Because it's something that the community really supported. And we used to always sell out Brent Town Hall and had to stop people entering because it would have been a health code violation. On the other side of things, we used to do things like lobbying the government. We used to go into schools and teach teachers and have whole assemblies teaching students, and we used to go into the community and hospitals as normal and training people and training nurses coming up as well.
Right, thank you. So can I just clarify, why was there such a need for Broken Silence? Like, what is it that, yeah, why did you feel that there was a need for it?
I think sickle cell is something that, even though it's the most common condition in the UK, genetic condition, people don't really know about it unless they know somebody with sickle cell. And if you say something like cystic fibrosis, most people would have had at least heard about it. And there are less people that are suffering with cystic fibrosis than sickle cell, but people more would understand it than sickle cell. And it's something that when you look at us, we look very healthy, fit, young, but in the inside, it's damaging our organs. It's affecting our joints, it's affecting our muscles. We have excruciating pain when, so basically with sickle cell, it affects your red blood cells. And usually red blood cells are round and squidgy, and they can flow through your vessels with ease. When you have sickle cell, when you go into a crisis, when you get a crisis, it's because your red blood cells have changed shape into more of a banana shape, and that causes blockages around your body within the vessels. And what happens because of that is it causes excruciating pain. So that could be anywhere from your arms, your legs, your stomach, your lungs, your chest. And for men, even in their penises, they could get a sickle cell crisis. And to give you definitions of what other people have said what a sickle cell crisis is like, it's like a young boy described it as if someone's smashing his arm or his body part with a hammer or slamming his head against the wall constantly. I've had women with sickle cell go into labor and they didn't know they were in labor because the pain is nothing in comparison to sickle cell pain. And the sickle cell pain, it's you can't tell when it's going to come. It's very spontaneous. It can, 1 minute you could be fine, the next minute you're just double down in pain. And it usually lasts anything from 18 hours to weeks or months. And so it's not something that is just a quick win or it stops. And things that can trigger sickle cell crisis can be anything from being too excited, too tired, not having enough like water, the temperature changing suddenly, going from hot to cold. There's so many elements in the world that can actually trigger sickle cell crisis. So you're always kind of on edge and planning for what might happen. And then there's a huge stigma around sickle cell. So people, when you go into hospitals, especially if you're male and especially once you're past the pediatric age, they don't believe that you're in pain. They think that you're there drug seeking, because most people with sickle cell are very clued up on what they need to get treated and what needs to happen quickly. The quicker you start treating a crisis, the better for you. The longer you leave it, the more likely you become critical and maybe even lose your life. So we kind of just wanted to take the stigma away, bring awareness to the community, because growing up, even in school, we weren't allowed to go to the toilet. You know, kids these days still aren't allowed to go to the toilet. And because you have to drink so much, and when I was going to school, you weren't allowed to drink anything in class. Nowadays, they let children have their water bottles. So it's like you needed to get permission to drink water in class because you need to stay hydrated. And to put it into perspective, most people are supposed to have like 8 liters a day. For us, it's almost triple that. The way that my consultant, Dame Sally Davis, used to get me to understand it is you have to make sure you drink at least once an hour, and have at least a liter of water at least once an hour. But you'd be in school and teachers would not want to let you to drink. And if you are allowed to drink, they wouldn't understand why you need to go to the toilet outside of, you know, the break times. And then, you know, even your peers, because they see you as quite healthy, they would think some children have issues where they think you're faking it. So with asthma, you don't get that kind of stigma. People understand that 1 minute with asthma, you're fine, next minute you're gasping for air. With sickle cell, they don't really understand how you can be fine and then the next minute you're in pain. I've had a nurse in school, when I was in school, send me back into the playground 3-4 times. And then it wasn't until the end of the break where my crisis had spiraled so out of control, where they called my mum in, and then I ended up in hospital, which could have been prevented if the first time I went in, they actually treated me as they were supposed to, which they had actually been trained to by my team. So it's just to reduce stigma in all levels of life. So this is as a child in school, as someone studying in higher education, as someone in work that might be struggling with employment. And I've learned that a lot of people with sickle cell don't get past the probational period because they can't make 3, 6 or 12 months without being sick at least once. So there's so much of a challenge around sickle cell, and that's why we felt it was important to start educating people from young, so that as they grow up, the environment around us changes, because they will have awareness and then they will share awareness to their children and so on.
Thank you. So just want to move on to some of the research that you set up around this. And knowing you, obviously, and hearing about this over the years, you've mentioned a few times where the treatments or how we research this hasn't necessarily changed over the years, in terms of we've not really advanced it to the same level if we've advanced comparable conditions like cystic fibrosis or anything like that. So that leads me to ask you about a project that you set up with Dr. Alicia Renedo. Can you talk more about that?
Yeah, so as we were making traction with Broken Silence, we became quite well known within the academic and the government scene. And Alicia Renedo approached myself and other members of Broken Silence about research that they wanted to do, but they didn't approach us when they had already decided. They kind of had an idea of what they wanted to do. They wrote the grant, but before entering the grant for submission, they wanted to meet with us, talk about what they want to do and talk about what they've written. And this was literally the best co-production I've ever been through. So we were able to influence what they wrote in their application for money long before it even had a chance of starting as a project. So we kind of structured what their research should look like. They had an idea of what they want to do, but we actually gave more in-depth insight. And then moving on, they had actually been one of the first people to consider financial implications for us. So within their grant, they had put a budget in where we would be paid regardless of how long on a day that we spent with them. We'd pay us a specific amount a day. So even if we were with them for 15 minutes, they'll give us a day rate. And they structured specific sessions within the timeline of their project to refer back to us and talk about what they've done so far, what their next steps are and what we believe. So there were times where, for example, before they did go out and start interviewing young people with sickle cell, because this was about transitioning into adult services, they would talk about it with us and our experience and what type of questions and what kind of environment we think people would be more comfortable being interviewed, because a lot of people would think, oh, we do it in the hospital or we do it here and there, but they actually got feedback from us and actually gave the participants the opportunity to decide where they would like to be interviewed. They had already got a soundboard for us from our experiences, and then when they did get the feedback from the participants, they then brought the results back to us and showed us the preliminary results sorry, and asked if that kind of sounded right to what we've experienced. So, and then they had discussions with us about what we think should happen next. This is, you know, as working together to decide what should happen next and where it should go for the research. And then furthermore, when it came down to writing research papers from this piece of research, they included us in that. They wrote things down and then they sent it to us, and then we would have a read through and make edits and make changes and add our statements and our point of views from the experience of this research project within that. And we were named on the publish as authors on all of their publications, because they worked with us to create it. They didn't, and then even when they did make changes from what we said, they then brought it back to us again after it was edited to make sure that they captured what we were saying correctly and then published it. So that from beginning to end, it was great communication. It was working together. And even though they were doing the fundamental part of the research, we were very much part of the team. So that was my best. I think that was probably the best experience of co-production I've ever been involved in.
Great. Thank you. I think we're coming to the end, if there's anything else you want to say, but I think it was just about your experience is really useful, I think, because of the disconnect you've had in terms of the advancement, like you've not had the advancements in treatments, and there's not been the focus of research on sickle cell.
Yeah.
As we've experienced on other things. And it's not that the other things shouldn't be funded either, or shouldn't be researched either, but sickle cell has kind of been in the shadows a bit. And I think it's really important to highlight this in order to look at how Lynn's assessment of impact and what we consider of having value and how things have value impacts people and conditions and treatments, and also the research on those. So that's really useful. So
I just wanted to add, so sickle cell is I think last year or the year before was the first time in maybe 10 to 20 years that they had new treatment for sickle cell. And most treatment that does come out for sickle cell is actually from a piggy bank off a cancer treatment. So even though it's something that's very well established in the UK, actually it's the most common genetic condition in the world. Even though that is the case, we still don't have as much advancements coming out for treatment and for cures. And the cures that are available are things that if it doesn't work, you die. So it's not something that, and it's not available to everyone, because you need something like, if it's a bone marrow or stem cell transplant, you need genetic matches like siblings, very like 99% matches. And then even if it does work, you're in isolation for years beforehand and after. And then it also doesn't really stop you from passing it down to your children. And then you've got situations where you still have people dying unnecessarily because of sickle cell and the lack of treatment and the lack of respect for people with sickle cell. So unfortunately, I think last year or the year before, sorry, time's ticking around, so I'm losing things through COVID, but we've had like 3 deaths in relation to sickle cell, 3 mainstream deaths. There were very more, where the worst example was a gentleman was actually in hospital being treated asked that he felt that his sickle cell was escalating. He was in there for another reason. He felt his sickle cell was spiraling. So that's the thing about sickle cell. You can't have one thing happen to you and sickle cell not join the party. They always want to be involved. Sickle cell's in everything. So he was in there for another reason, but he felt his sickle cell was coming up, and he asked for oxygen because he felt he needed oxygen. And like I said before, people with sickle cell know what they need when they need it. Most of the time they can feel it in their body, and he was not given it. He was ignored. He was not given it, and he was in his bed and in the ward and called 999 from his bed because he was not getting the treatment that he needed. They didn't even bring a hematologist in to consult, and unfortunately he passed away. And when they did a review of why he passed away, it showed that if he had got the treatment he was asking for, he would still be with us today. He would not have died. And that is one of the worst cases I've heard of over the last few years about sickle cell. And it just shows that you can be in a place of care where you think your life should be safe in their hands and still lose your life because of the lack of awareness, because of the lack of being willing to speak and willing to listen to a patient. Because as far as you're concerned as the healthcare professional, you know more because you've studied 10 plus years. But actually we've been living with this for our whole life. So I have 37 years experience of sickle cell. So, and one thing I always say, it's your job, but it's my life, you know. So you can get a new job, I can't get a new life. And I kind of just want to leave people with that in their minds, that when they are working with patients and the public, remember that their lived experience is is valuable. Like it, and it's not just that they're someone that is sick. They actually are professionals as well. They have jobs. They have skill sets that could be utilized beyond just giving their opinion about their condition. So my son's saying hello. So I just wanted to leave you with that. Just see people as assets, not as a problem, because when you start to work together and co-produce, I've never met anybody that has done it correctly that has regretted it.
Thank you, Cherelle.
Thank you.
I'll hand back to Lynn.
Thank you so much, Cherelle and Mira, and actually feel quite emotional just with what you said at the end there, Cherelle, because it is just so true, and that's been my experience. So I want to hand over now to Niccola from the Co-Production Collective. It's going to give us another perspective on impact and evaluation. Thanks, Nick.
Thanks, Lynn, and hello, everybody. So I'm Niccola, or Nick. I am, there you go, part of something called Co-Production Collective, and we are a community of people. So we are people from all different areas of the world, actually, with all different types of experience, both living or lived and learnt, or a combination of those, coming together. And we come together with a shared passion for co-production, for co-producing ourselves, and for supporting others to do this kind of work as well. Really open to everybody. And we did start life at UCL, so University College London, and we're still kind of what's the word? I don't know. Hosted by UCL. We started life with some funding from Wellcome Trust, which was all about culture change. And it was all about culture change within universities specifically. And we identified that we wanted to really try to do something long-term with this funding, rather than what previously it had been used for, which was to fund small grants around kind of involvement work. We didn't think that was really going to cut it in a culture change space. And so the idea of the Centre for Co-Production, as it was called back then, started. And we spent a lot of time, or I did initially, because it was just me, going out and getting to know people, having a chat in the local area, in the local kind of hospitals and within the university, and just talking about what was going on. And, you know, not specifically about this centre, building relationships basically. And though it was difficult, I'm not gonna lie. You know, a lot of people were very frustrated by the university they were approached by multiple people asking for information, you know, and disappearing to continue on with the research. And they were fed up, basically. They wanted to be part of something bigger, and they wanted to have that ongoing conversation rather than just kind of what felt like being used basically for information. And then they never found out anything else. And so I had to spend a lot of time building trust and getting to know people so that they felt able to be part of what we were trying to build, which we didn't really know what it was, because the idea was that we were going to co-produce this thing with a real mixed group of people. And our work continues on as so that was back in 2017, and we continue on as a really open community. People come and go as and when they want to get involved in what we're doing, and we really try to maintain our kind of ethos and approach in everything that we do. And this that is on screen currently is what we call our approach to co-production, and it's what it means to us. And as a community, it means to us that it's an approach to working together in equal partnership for equal benefit. Now that is a massive statement, right? You know, we are under no illusion that that is aspirational, and we're always working really hard to try to achieve that. And, you know, probably never ultimately achieve that, but we try, and we really try based on our values that underpin this approach. And they are things that we really try to live and breathe, because we, as a community, really feel that actually that helps us to try to live up to that approach to co-production. And we co-produce these values ourselves as a community, and they are about being human. So really treating people as people, and remembering, you know, that we're not a statistic. We're not a group that all think the same or all behave the same. We're all different, and we all come together to work together on whatever it is we might be doing, and to build that relationship and get on to whatever it is we want to do, basically. And linked to that is about being inclusive. So we work really hard to try to remove barriers to people getting involved. We try to use language that is accessible to all, and, you know, if we ever do use any jargon or acronyms, we instantly make sure it is explained. We really try to be transparent as a community. So there are members of staff. There are 5 of us who are kind of what you might call staff members. Sorry about the pinging, that's my email. There are 5 staff members, and in order to play a kind of role in this, we take on a kind of coordination role, I suppose. So we make decisions as a community, and then the staff team go away and put those into action. And we talk about, you know, constantly about what works and what doesn't, and we try to be really open about that. We don't go away and make our own decisions, you know, just disregard what we discussed as a community. But that ability to do that has really been built up over the last kind of, so 2017 was when we started, what's that, like 5 or so years, that trust that we do what we say, and we don't just disappear off and do our own thing. And the really important one that I think is really relevant when it comes to kind of to impact and moving forwards is that we try to challenge, and we really try to challenge not only ourselves as a community involved in co-producing ourselves, but also in a variety of other projects. We challenge ourselves to think about, you know, what has worked, what hasn't, how can we improve this and move forwards? And we do that during everything that we do, constantly, regularly, not just at the end. We take time to do it throughout and try to make changes then and there so that then we can move forwards. But, you know, if that requires us to stop and pause and think through as a group what's going on and where do we need to sort of move next, we try to do that rather than continuing on sort of ignoring, I suppose, things that are happening. But we also challenge the system. We really try to think about what it is that's causing barriers to people getting involved. You know, things like the pressure to achieve kind of publication when it comes to researchers. That makes it hard for those of us who struggle with long research publications to engage with the information, but it also makes it hard for the researcher to think outside that box sometimes, if that's the pressure coming from senior management. And as an entity within the organization of UCL, we have tried to really challenge internally, but share the impact that we're having and use that externally as well for others, or share it for others to be able to make use of. So we do get a lot of pushback from a variety of spaces as to why co-production, where's the value? And so as Lynn mentioned, we did a piece of work called The Value of Co-Production. So it was a research project, and we split it into sort of 3 main areas. We did nearly 100 interviews in a community reporting style, which is where members of the community take the interviews rather than an academic. And then we did a survey using Gobby survey tool, which is designed to be a bit more interactive and kind of towards a co-produced approach. Nearly 600 people responded to that. And then, as Lynn mentioned, we did a rapid review of the evidence using academic techniques to interrogate a lot of different papers that cite co-production. And the key findings, if Lynn hasn't already, I'm sure she'll put the link in the chat, but please have a read. We really tried hard to make sure we could have as big an impact as possible with this work. And we presented it in video forms, in short report forms, in massive long 80-page reports, if you like that kind of thing. And we provided a range of different versions of it in everything from Braille to EPUB to a screen reader friendly version of it as well. But the key kind of things that we pulled out in terms of the findings are the 5 things that are on screen at the moment. And I doubt they'll come as a surprise to people, sort of already involved in this space, but they are that the value of co-production lies in delivering outcomes that actually matter to people, in efficiency in the long run. People always talk about how long co-production takes, initially perhaps, but you save bags of time later on when you've already challenged some of the things that may cause problems down the line. It assists in working towards social justice. And the next one is interesting. So it empowers people and builds capacity. Now we put a star against that because some people don't want to be empowered. Lynn's laughing because Lynn always talks about this, but not everybody identifies with that being empowered. Actually, they feel they have power already, but it's the access that's lacking, right? But that did come out from a lot of people, so that's why we have included that. And then the 5th one, it connects us as humans working towards shared goals. We hope that research can be really valuable for the sector generally. We work a lot in the kind of health research space, but we also support in other sectors, and we work providing advice and guidance in terms of research, service development, and also policy. This research, we hope, will really support others to work in this way. A really interesting finding, which I think Lynn already mentioned, is around the evaluation, and that not enough evaluation is done about this work. And, so we hope to do some more work on that in the coming months and years with some additional funding that we've managed to get. We want to try and provide a framework or some kind of support or whatever it is that helps people to do more evaluation of this work and ultimately, hopefully, adds more value in the future. I just wanted to talk a little bit about, I suppose, the work that we have been doing. And we recognize that we have a lot of privilege as a community. We sit within a very large university. And I mean, that has its challenges, obviously, but it's also a privileged space to be in, that we are given kind of space in terms of office space and that kind of thing. But in order to embed co-production in a way of working, which is what we've been trying to do and are still trying to do, you know, the culture change work within the institution is going to be a very, very long process. We are not going to go from where we started out to having a really embedded, co-produced way of working across the entire university overnight, or even in 10 years. It's going to take time, but we hope ultimately we won't be needed anymore. But what we really try to think about is this diagram on the screen from Social Care Institute of Excellence. I think it's quite an interesting one, because it splits up the kind of key areas that you really need to address if you want to try to embed co-production. And culture, so that's all about the beliefs and values that define an organization and the way it works. You know, you need all of these 4 things in place in order to really start to meaningfully get co-production embedded. The second one is the structure, so the way the organization is arranged and the systems are set up. If these are constantly fighting against co-production, which, you know, we have come up against some of those things, it makes it really difficult to do. So it's about breaking down some of those things and trying to find alternatives. Practice, so you need to practice the co-production and keep trying and learning and developing as you go. And then the review part, so constantly monitoring how the work is conducted and the outcomes or impacts that result. So gathering that evidence and learning from it as you go along. Oh, I've gone a bit far. So I just wanted to finish on a few kind of things that I suppose that we, reflecting on what we've been doing and where the challenges and that kind of thing have been. So the values-based way of working that we have has been absolutely fundamental, but we do have to continually challenge ourselves on that. Gathering evidence has been vital in this push for change. Raising awareness, you know, without that element of raising awareness, it's really difficult to make connections and to amplify a message as a collective group of people. You know, we don't just do it ourselves, we try to do it with others as well and partner on things to further amplify the message and increase the impact that we and others can have. The embedded culture of learning has been really important. You know, without that, we wouldn't move forwards in such kind of a meaningful way, I don't think. You know, we would sort of potentially meander around, but that learning really helps us to take giant leaps forward. And we really try to share that learning with others as well to hopefully aid them. I think the key reflections from my point of view would be that bringing the how to life is the really valuable part. People really struggle with co-production, the how piece. Without that how, it's difficult to know like what to do, and then the impact that you can have is lessened because you're not quite sure how to get going. So we spend a lot of time trying to support people around how to work in this way. The community space is really important because it can be really tough to get involved in co-production. You know, it's not embedded as standard in a lot of places, and so there's a lot of pushback, and you know, we have some unpleasant conversations, not as a community, but with people we work with sometimes, because what we're trying to suggest is a scary thing for some people, and it can be seen as a risk. And, you know, so people want to challenge us on that, which is fine. And we love a challenge, but sometimes it can tip over into something a bit more unpleasant, which is where having a community that can support each other is really important, because then we can help unpick it together. And we have these things called co-pro cuppers once a month, which is a really great space to meet others and have a conversation. It's really important to be open to challenge. It's really difficult if you struggle with being challenged, because so many people, as I said, want to do that because they find it a difficult space to understand. So in order to reach the kind of to have the impact with our work, we've had to be really open to that and develop it as we've gone along, to try and embrace it and take the positive out of whatever challenge comes our way. And yeah, the being a part of a university, both positive and negative, I would say. It helps, but it also sometimes can be difficult with the bureaucracy and those kind of things. So that is it from me. I will stop talking, I promise. Please feel free to, I'll put an email in a moment, join us for a CoPro Cuppa, and we do those once a month. We have, it's basically a networking kind of opportunity. Please engage with our value of co-production research if you want to. And we do have a massive resource library that is open to all, and I will put the link in the chat. Yeah, thank you very much.
That was great, Nick. Thanks for the overview of the fantastic work that the Co-Production Collective do, and I'm biased because I'm really proud to be a member of the wider collective, and I think that's the wonderful thing about it. It's just it's open to everyone. So I have been combing through the chat for questions and also the question and answer session. So we'll just maybe touch on a few issues, and then what we're going to do is to go into breakout groups. And one of the first questions that caught my eye is how can culture be changed through universities and research institutes, funders and organisations? So I don't know, Nick, Mira, Cherelle, who wants to have the first go at that one. It just, I suppose I've picked that out because it seems to me that this is a lot of what we've been talking about is changing culture. Nick, do you want to?
Sorry, could you repeat that? I was reading the chat. I'm sorry.
So it's just a question about how culture can be changed in universities, research institutes, funders, and organisations. Any top tips?
Not a big question then at all.
No, not at all. No.
I would say there's a lot of things you need. Time, sort of dedication to it, I suppose, a big network of people and partners to call on, to collaborate, to commiserate, to, provide that. Tenacity, I guess. We just keep going after stuff, we keep challenging, we keep going back, even though, when we get pushed back down, we keep trying to do that. And the other thing I would say is examples, of the work. It's interesting, we constantly get asked for case studies and then people never read them. So we're trying to present them in different ways. And we have a big collection of CoPro stories, which are a load of videos where people share experiences and things that, yeah, that's it for me.
Cherelle or Mira, do you want to come in on this?
I was going to say, I do think those organisations have a key role, and I think they have a key collective role. And over the years, for example, the fact that the National Institute of Health Research has expected people who want funding to have plans for how they're going to work with people and communities has been a real driving force to encourage people to do that. And I'm a skeptic, so so I was not expecting that to be the case. I thought, it's people are just not going to adhere. But it is one of the things that people have said actually do influence them and encourage them to shape plans. And there's a lot more to do in terms of, obviously monitoring that going forward, ensuring that happens in practice, etc. There's still a lot more to do. But I think having a clear steer from these types of organisations is really useful and beneficial. I'm not sure it always has to come just from the organisations, though. I think there's something about how can we as people and communities and patients and all these types of people, how can we influence that as well? And I think I'm just going to go to Cherelle's thing, because the research project that they set up that was funded by the NIHR, it was them, do you know, like it was them kind of initiating that. So I'm going to hand it over to Cherelle but I think there is something there about this two-way relationship between that. Yes, they need to set expectations, the organisations, but also how can we influence that as people and communities as well?
Yeah,
Cherelle, yeah.
I don't know if I have much to add to that. I think it's just continuity as well. And it being reinforced from people who are starting it. So whoever's trying to change the culture, they need to constantly reinforce it, and they need to get the senior people involved to constantly reinforce the change as well. And then, you know, people are going to be reluctant sometimes. Change is hard for most people in any kind of state. So I think it's just putting them in positions where they can see it for themselves. So it may not be impacting their work directly, but if, for example, they're at a learning event and they see patients talking at this learning event and seeing how impactful it was, then it might change the perspective of how they view them. So that kind of little things like that changes the culture. It's like quick wins, I always say.
Mm-hmm. No, great points, thanks. And there was an interesting question on the definition of co-production, and it was interesting because when we were doing the rapid systematic review, we didn't want to be seen as the co-production police. You know, kind of sitting in judgment on, but there's a question that, you know, just what points are essential when classifying something as co-production or not, as opposed to full production. I don't know if anyone wants to come in on that. Nick, and maybe the co-production of the values, yeah.
I mean, I think the power and shared decision making is a key thing when it comes to co-production, right? And making sure we're leveling or trying to level the playing field in terms of the power in a room or a space, and trying really, really hard to share that decision making, but, you know, being open about the power that each of us hold in different situations. I don't want to take all the stuff, so I'll say that.
Yeah, I mean, I think for us, when we were doing the value of co-production rapid systematic review, and when we wrote the 70-page report that Nick mentions that you may or may not want to read, I think the really good thing for me was that we each wrote something about our positionality, and also the reflexive discussions that we'd had while doing the project were in the report, and we talked about the benefits and the limitations of working in this way, and much of it is just about being actually open and transparent about, because I think we were very clear about the limitations to the extent to which the rapid systematic review was co-produced for, and just being transparent about that. I don't know if Mira and Cherelle, you've anything to, yeah.
I was going to say, I think there is something also about how we kind of create spaces for this as well, and the learning, and the fact that we have to work together and figure out how we do this. And as you said before, Lynn, the kind of trying to create the spaces for that. And I think there's still a culture where people aren't able to say, we don't know how to do this, and especially I'd say our research colleagues. So I've had experiences, for example, with a research colleague who, and it's not in my day job, I work with people in communities, in marginalised people in communities outside of my day job, and I do that, and it is shaping research still, but I do that outside because of, I never know how it's going to turn out, so I don't know what the political fallout is going to be, etc. So I do it in my personal capacity. And there was an issue with some of that research once, where a researcher had worked with one lot of marginalised communities, and they wanted to basically take those findings and apply them to another marginalised community, which had nothing, like these communities were you know, there was nothing similar about these communities apart from the fact that they were both marginalized and racialized. And I think, and there's that sense of that person couldn't say, oh, I don't know what I'm doing. They were just like, oh, but I've done this project with so-and-so, so I could just take those findings and apply them to this community, as opposed to saying, look, I don't know what I'm doing. And being open and honest with those communities and saying, look, hands up, I need some help on this. And I feel that there isn't that ability to be vulnerable all the time. And I think there's a bit of a difference between when you have people in communities that they're a bit more able to say, actually, I'm not sure about this, don't know, can we figure it out? And some of our other colleagues struggle with that.
No, that's great, Mira. And actually, I think it overlaps with a question that Andy had asked in the chat about about the skills that researchers need and whether they feel confident about involving people and co-producing with them. Cherelle, I don't know if you've got anything to add to
No,
what constitutes. Yeah,
I wouldn't want to add to that. That was perfectly summed up from Mira.
Yeah. Wonderful, thanks. So I think the thing we're going to do now is to go into breakout rooms, and then we can come back for the last few minutes, and I will look at what's on the Mentimeters and the Jamboard and the questions in the chat and whatever, and try and write a blog, which is going to be a really difficult task. How do you write synopsis of this wonderfully rich conversation? So anyway, so if you can do the breakout room magic, thank you, Nikki, and we'll see you all in about 15 minutes. Yeah.
Great, thank you. I'm just going to open them now, so you can just accept as soon as you get the notification. Thank you.
Hi everyone. So it just remains for me to close the session. I don't know, any reflections, Nick, Mira or Cherelle, on the session, or conversations that you had in the breakout room, any burning things that you would like to share before we end?
I think one thing I'd like to share is somebody in the room, which I stated experiences which I think resonate with lots of us, where didn't want to commit to something. Sorry, I can't speak today. Didn't want to commit to something that they couldn't really deliver, and therefore, with all these experiences, with all these opportunities to get involved and to work together, that could really hinder what they could be part of or what they wanted to be part of. And I think there was that sense of just needing to kind of really reflect together about how you work together, having the opportunities to step away when you need to, and really articulating that from the get-go. And that means about how you work together, but also then how you assess the impact that you're having as well, and how you reflect together about the impact. Being able to offer those opportunities will be quite useful.
Oh, great,
Yeah.
Thanks, Mira. Cherelle?
Yeah, in our session, there was talking about about bringing research to researchers, and how that would look and whether it's ever done. And there was also a look at kind of realizing that actually within certain community groups, we could be doing the same, working in silo and doing the same research and not collaborating together. So it was kind of just talking about our discussion was focused around how we do what the community wants to do, but not just from us telling them, but them telling us, and how we can actually take the first steps to collaborate outside of our organizations with other organizations and produce research together rather than working in silos. I don't know if anyone from my group wants to add to that. No, they're
I think-
happy.
Yeah, I think that's a great reflection, Cherelle, because I've reflected that before I just co-produced some qualitative research into people's experiences of shielding, and I was co-producing has made me realise how siloed I was in terms of not understanding what it was like for researchers and trying to get a piece of research funding. And actually Shan made a really good point in our group about the conditions for co-production and in workplaces at the moment, where contracts are very casualized, and the experiences that people have while they're working in the culture of organizations, and how the culture can impact on them as well. Nick, do you have any?
I think for me it's a reminder of like all the different perspectives that go into this kind of work, and sometimes I'm guilty of getting a bit carried away by co-production and forgetting the outside pressures that everybody has on them. And I think that's really important when it comes to changing culture, but also thinking about the resultant impact. Those impacts can be both positive and negative, and I think for me, I need to remember that and not get too carried away. But the enthusiasm is I feel the enthusiasm in the room, which is great.
Yep. No, absolutely. So a massive heartfelt thank you to everyone for turning up, and the wonderful questions in the chat, the wonderful discussion in the breakout rooms, and just really engaging with this topic. As we say, we're going to share the recording. I'm going to attempt to write something about the conversation that we have, and which we will put out. And also what I will do is collect all the links that have been shared to the wonderful pieces of work and whatever that is going on for people. So thank you so much for attending, and let's just hope that this is the start of the conversation and that it's not being had, if you see what I mean. So thank you.
Thank you. Thanks, everyone.
Goodbye.
Bye-bye.